Hi, my name is Sarah Hinton. I'm also a physician, board certified in both pediatrics and internal medicine, which means I'm a doctor for both adults and kids. And I've been getting a lot of questions in my office lately about the COVID-19 vaccine. As you may have seen on the news, the COVID-19 vaccine is a special kind of vaccine called an mRNA or messenger RNA vaccine, which is a really smart way to create immunity in our bodies. The mRNA acts as an instruction sheet for our cells to create the spike protein, which are all those bumps that you see on the outside of the coronavirus when you see pictures of it. The immune system responds to that protein and creates our immunity to the virus. It's a really smart way of creating immunity. The other really smart part about it is that it makes the vaccine very safe. The mRNA degrades pretty quickly, which is why you may have heard that some of the vaccines need to be transported in really cold temperatures. That's to help preserve the mRNA. So that makes the vaccine very safe overall. Several months ago, when there was first talk of the vaccine and that healthcare workers would be of the first group to receive the vaccine, I was a little nervous thinking that I didn't really want to be a guinea pig for a vaccine that had been rushed out. But the truth of the matter is that the creation of this vaccine really shows what great things can happen when we pool our resources together. So there were enormous financial resources, there was a significant reduction in red tape, and that allowed the pace of the vaccine production to be much faster than what we've seen with previous vaccines. The actual vaccine trials themselves were not rushed and took place just as they would in any other setting. They had the same number of participants and lasted the same amount of time that any other vaccine trial would have. That plus the FDA approval here in the United States and the other approvals across the globe helped me feel that this is a really safe choice for me, for my family, and for my patients. There are very few risks to the vaccine. As you may have seen on the news, if you have a history of serious allergic reactions and have to carry an EpiPen, you need to discuss whether the vaccine is a safe option for you with your doctor. But for most other folks, this really is a very safe, very effective vaccine. The vaccine should have a 95% efficacy rate in preventing you from getting the COVID-19 infection. And if you do get it, it has a 100% efficacy rate for preventing severe complications from the coronavirus. So for me, that's really, really good news. You may have also seen on the news that pregnant women were not included in the vaccine trials. And that's how most new medication trials are done in the United States. However, the vaccine is felt to be very safe in pregnant women. And we know that when pregnant women get infected with COVID-19, they become high-risk patients. So for that reason, the American College of Obstetrics and Gynecology, which is sort of like the professional society for OBGYNs, has said that the COVID-19 vaccine needs to be offered to all pregnant women, but that we should also respect their decision should they choose not to receive the vaccine. There are no theoretical or known effects of the vaccine on fertility. So if you're thinking about having a family in the future, I would definitely recommend the vaccine to help prevent you from getting COVID during your pregnancy. Also, if you're breastfeeding or will be breastfeeding, there are no known or theoretical risks to receiving the vaccine while you're breastfeeding. In fact, there may be some added benefit of passing immunity on to your nursing infant. As you may also be aware, children were not included in the original vaccine trials. And that is also very typical for how we perform drug trials in the United States. However, we're hopeful that we'll be able to study the vaccine in children, and we'll hopefully have the vaccine approved for children by the end of the year. It can be tough to make decisions about your own health care, the health care of your family members, especially with something that seems very new and poorly understood. But I do think that the science here is really very strong. The vaccine is very safe and very effective. And so sometimes it can seem like the easier choice just not to do anything, not to choose this vaccine that seems like it might be scary. But we know the vaccine is low risk. and we know there are a lot of risks of COVID-19 infection. We likely all know people, friends, family members, members of the community that have been hospitalized or even died because of the virus. The mortality rate is much higher than that we see with the flu. And we know that about 10% of people who get infected with COVID-19 will have long-term effects of their infection. So we know that infection with COVID-19 is a high-risk scenario. So the choice you have to make is between a low-risk action versus a high-risk inaction. If you still have questions about the COVID-19 vaccine, check out reliable sources like the Center for Disease Control website or the World Health Organization website. Talk to your own doctor, and you're always welcome to reach out to me as well to answer any questions that you might have.